this video, it's going to be my trach care. The very first thing I want to do, I'm going to assess the patient's respiratory status. I'm going to get an O2 saturation, a respiratory rate, and assess the breath sounds. Okay. So I went ahead and assembled my equipment. I put in a patient's in a high flowers position, or in a semi-flowers position at a good working height. I did use my 2 patient identifiers, and I am using my general safety practices. I'm going to perform, I'm going to place this chuck across the patient's chest. Then I am going to perform hand hygiene. I'm going to don my PPE.
Smart. Good idea.
And I performed hand hygiene before I did this as well. And I'm going to go ahead and open my tracheostomy kit and set up my sterile field. I got my gloves. And I'm just touching the shiny side. Okay, so now I have my sterile field set up. I'm going to pre-oxygenate the patient. I'm going to put on clean gloves. Okay. Okay. I'm going to remove the oxygen, and then I'm going to stabilize the faceplate and the cannula, and I'm going to go ahead with my go ahead and take this out. Okay, I'm going to put it in my glove, and then I'm going to discard it. And I would normally put it in a red bag, but my red bag's not closed, so I'm going to pretend that my bag is closed. So I'm just going to put everything right there. So next, I want to put on my sterile glove. I'm going to perform hand hygiene and put on my sterile gloves. I can fix it because these both gloves are sterile. I'm going to take all my supplies. And I'm going to go ahead and pour my hydrogen oxide cleanser. And discard that. Sterile water. Discard that.
Okay. Which one you done?
Okay. So with my non-dominant hand, I am going to place, I'm going to keep this, I'm going to stabilize the face plate. Then I'm going to take the new trach, I'm going to carefully place it without touching my non-sterile hand. Okay. Oh goodness. Okay. Now I'm going to take Q-tip, go ahead and clean. I'm going to go in one motion using one Q-tip per spot. Dip it in the solution, go around, dispose, and then I'm going to take sterile sponge, and I'm just going to pat dry without crossing sterile field. Dispose. So now I'm going to put the new 4x4 underneath without breaking sterile field, the face plate. While remaining sterile. Okay. Now, I do not need to be sterile. I'm going to take off my sterile gloves. And I'm going to put on clean gloves. And I'm going to change the tracheostomy holder. Now, it can be a two-person job or it can be one. Since there's only me, the way I would do is leave the old one on the outer and put the new one in the inner. So, let's see what I'm doing. The reason why I want to do this is because so the trach does not get dislodged. I want to go ahead and take the new one off. Okay. All right. And then I am wanting to remove my gloves and my PPE. Put it in a bag. I'm going to go ahead and dispose of everything while gloved. And then I am wanting to reassess the patient. Perform hand hygiene, and I'm going to go ahead and reassess the patient. I'm going to get their O2 sat. I'm going to get the respiratory rate. And then I am going to get their breath sounds. And everything is going to be disposed in the red bag. And then perform hand hygiene, put the bed in the lower position, get the patient the call out, make sure they're comfortable, and go ahead and document my trach care.